Hello, my name is Cliff Keith, creator and developer of DialysFlux, and I'd like to introduce my friend, Dr. Vo Nguyen of Memorial Nephrology Associates. Dr. Nguyen, could you explain to us what is end-stage renal disease?
Patient with end-stage kidney disease is defined as having lost over 90% of the kidney function. Kidney filter blood to keep people alive and to get rid of the waste product. So without kidney function, patient usually died.
How many patients are on hemodialysis, Dr. Nguyen?
This graphic shows the rapid progression of the number of dialysis patients in the US over the last 3 decades. So we now have reached more than 400,000 patients on hemodialysis. And in fact, it's a progression worldwide. I suspect that there's more than 1 million patients on dialysis.
And what is hemodialysis?
Well, this is the hemodialysis machine. And here is the patient. And here is the fistula. This is a vascular access. And you can see line coming out of the fistula. And blood is pumped out of that vascular access. This is the pump. And this is the filter. And then the clean blood then return to the patient.
So Dr. Nguyen, how do we access the vascular system of these dialysis patients?
Well, we need 2 needles. And this is one needle that I showed here. This one to pump blood out and one to return blood to. And we need to do dialysis 3 times a week for the rest of the patient's life.
Why vascular access?
Oh, very simply because we have to pump a lot of blood out of the patient to clean the patient for over 4 hours, 3 times a week. And the normal vein cannot provide that kind of flow, much less than what we need. Hence, we need to create what we call a fistula, which is a vein that is here that is connected to the artery, so that over time, blood flow from the artery pump into the vein, cause the vein to be enlarged. I hope you can see how big that vein has become. And this is a fistula, and it's used native vein to achieve. The purpose of doing surgery is to obtain what we call a mature fistulas, so that the vein is enlarged by at least 4 millimeters in the diameter with very high blood flow, 500 cc per minute at least. And it's very important that these veins develop a thick wall, and this is why. The vein wall is usually thin, and here is the example of thin wall. And what we need is, over time, the vein go through what we call arterialization of the vein, so the vein wall become as thick as the artery as shown here. Why thick wall matter? Well, very simply because we have to use a very large size metallic needle and that poke a hole in the vein and to pump blood out at high speed. Now, high blood flow rate, high pressures, thin wall, a large size needle, we can ask for problem bleeding. And here's an example of the severe bleeding, especially with new fistula. It can be catastrophic for the patients because if it's infiltrated, we cannot use it. And it can also damage the fistula. The bleeding, furthermore, can be very painful to the patients. And because we cannot use a fistula for dialysis, the missing one single dialysis can result in patient sudden death, and that's not acceptable. If the fistula cannot be used, then one has to put a catheter in the neck inside a large vessel atop the heart, like I shown here. And this catheter can be used right away, but it can cause severe infection and cause patient death as well. So it's very desirable that we have fistula and we don't use catheter. And we have to be able to use the fistula safely. And this is why Medicare have launched a national initiative called Fistula First and Catheter Last.
So these fistulas are very important to the well-being of a dialysis patient.
It is important for the well-being as well as important for them to stay alive.
Do the patients ever complain about the sharp-tipped catheters?
It is painful, yes. They use anesthetic to deaden the pain.
What do you think are the potential advantages to use of a Teflon catheter?
Well, let me go back one step. Because of the risk of bleeding, we have been searching for a way to prevent bleeding or to reduce the risk of bleeding. And this is how bleeding happens. When the needle enters the front wall of the vein, that's one place where it can bleed. The needle, when we push it farther or the patient move around, the needle can move forward and then perforate the back wall. And that is another severe source of bleeding because we cannot even see it. And just imagine the size and the sharp needle that we use. So that if we have a non-metallic catheter like Teflon catheter that we are discussing today, once the needle enters the front wall, the needle serves as a kind of a guide needle so that we can push the catheter over inside the vein. And because the Teflon catheter is not sharp, it cannot go through the back wall. Hence, it should reduce the risk of bleeding. The Teflon is like plastic, the same stuff that you use for your non-sticking pan, so that it's soft and it's not traumatic. It should not pop through the wall on the vein. The problem is patients dialyze for 4 hours and they cannot move. If they move their arm, the needle pops through the wall and causes severe bleeding. Now, if you have a non-traumatic end of the catheter poking through the wall, hopefully that does not occur. Further clinical trial in real patients will be needed to prove what we try to demonstrate today. It does not cause bleeding, and severe bleeding can cause damage to vessels.
Thank you for being here with us today, Dr. Nguyen.